Some guests you meet for the first time across the mic. Dr. Chethan Sathya isn't one of them. We first crossed paths years ago at South by Southwest at a speaker dinner, and we've been friends ever since, though our conversations usually wander far beyond healthcare. So this one was a treat. It was a chance to finally drill down on the remarkable work he's doing, and it really is remarkable. Chethan is a pediatric surgeon at Northwell Health, a trained journalist, public health leader, and turns out an Oscar-winning consulting producer on the documentary All the Empty Rooms. He leads Northwell's Center for Gun Violence Prevention and has a rare gift for finding common ground across deep divides, whether at an NIH roundtable or a red state movie screening. We talk storytelling, firearm injury prevention, AI in healthcare, optimism, and yes, Michael Jackson. Enjoy. Well, Chethan, it's been a long time since we have had a face-to-face. I think maybe last South by Southwest or the health conference. But anyway, we've known each other for a while. I'm excited to do this. You've been up to a lot, and we're going to share what you've been up to with the guests as we get rolling here. So I do like to start usually with the origin story for anyone that comes on the show. And I sort of knew some of this, but in doing my research, I learned a lot more about you. You've held a lot of positions, many overlapping over the course of your professional life. And the fact that you're like 25 is kind of amazing that you've done all these things. But your LinkedIn bio says you're a pediatric surgeon, physician executive, and public health leader, working at the intersection of healthcare delivery, technology, and policy. You worked for many years as a freelance medical journalist at CNN. That was one of the things I did not know. The way I kind of got to know you was through this whole concept of, and I'm going to say it right, firearm injury prevention. We can't say gun control because that sounds like we're trying to control guns. Tell us a little bit more about what inspired this path of doing these, again, related, overlapping, but somewhat disparate activities that you focus on.
Absolutely, Aaron. Yeah, no, it's great to catch up. I still remember the first time we met at a South by Southwest kind of speaker dinner.
Yeah, that's right. That's right. Like 5 years ago, maybe 6 years ago. Yeah, I do.
Yeah.
You and Jay Bott. We'll give Jay a shout out, and Anita Bose.
Exactly. Yeah, yep. and then Geetha Nair was there as well.
And Geetha, yes, yeah, and all the crew.
Yeah, so that was one of the first times I met you, and I know it's we've had a friendship since that time. So I've really loved to see what you're doing to kind of enhance the conversation across all these domains.
Thank you.
For me, where do I start? I mean, why don't we start doing my residency, right? As a general surgery resident in Toronto, I took a couple of years off to do a master's in clinical epidemiology. I was really interested in research, started doing research, publications, and so on. And I became increasingly frustrated by the fact that no matter how much you publish, right, it was apparent to me that unless you are able to incorporate storytelling and reach the public, it's really hard to move legislation, public health policy forward, and it's really hard to change minds, right? And I think that statement is more true now than really it has ever been, right? We know that it's actually stories that really compel folks to act, right? Ideally, stories backed up by data. That is the most powerful thing you can do. But data alone, without those stories, particularly in this current environment, often, when it comes to public health policy and so on, doesn't get folks alone to act. And so I wanted to pursue a degree to try to understand how do we start incorporating storytelling in everything we do, everything I do. How do I start writing for the mass media, for the public? And that's why I did a journalism degree in Toronto. That was eye-opening. Really taught me to be able to kind of converse with people out there in many different ways. So after that journalism degree, finished my master's, right? I always had a interest again in advocacy, storytelling, policy. But then I went off to be a general surgery resident, and then continue my residency, do a pediatric surgery fellowship in Northwestern in Chicago, and then became attending pediatric surgeon here at Northwell Health about 5 or 6 years ago. And in medical training, you don't really think about what your next steps are necessarily until you're done training. All you can see is that end goal. Okay, finally becoming a staff surgeon, for example. And it was really here in Northwell that I finally had that ability to take a breath and just say, listen, now how do I want to take some of the skills that I was able to learn? My love for conversation, for really finding common ground on issues, being open-minded. How do I want to take that to the next level and work that into my career? And right place, right time. That's why when I got here to Northwell, I found out our system wanted to take a big stance. Our system CEO at the time wanted to prioritize gun violence prevention or firearm injury prevention. that fit very nicely with some of the issues I advocate for. You know, I'm a pediatric surgeon, treat trauma as well, treat kids with gunshot injuries, unfortunately. And so it all came together. And that's really what started it. You know, that's how we grew the Center for Gun Violence Prevention. That's what allowed me to take on this additional vice president role in Northwell, leading a number of our other public health initiatives and our health technology efforts. And that's kind of how it built.
Well, so a couple of things to unpack there. One,
Yeah.
thank you for all you're doing. That's amazing. And I like hearing that story because, again, I met you sort of knowing what your platform was, but now the dots are connecting. And I am a big believer in the whole storytelling and changing hearts and minds. And I do want to get to the piece that you talked about regarding bringing sort of different thinking people and different points of view into the same room. I do want you to just tell us a little bit more about Northwell Health, though, because some folks that are listening in may be unfamiliar, and I want to give you the opportunity to give your company a little pat on the back.
Yeah, Northwell, you know, I've been really fortunate to be here. I mean, it's such an incredible healthcare organization. It is the largest health system in New York and the largest employer in New York. You know, by far, we have dozens and dozens of hospitals. And so coming here has been an incredible opportunity because Northwell Health and its entire leadership really does consider health to be an offering beyond the four walls of our hospital. And they are not shy to take on issues like gun violence prevention, maternal mortality reduction, other public health issues. And so for me, it's been a incredible journey to be here. I didn't actually expect that, but that's a little context for Northwell Health. So certainly very innovative organization that's looking to kind of push the needle forward on some of these big issues.
Well, I had no idea that they were the largest employer in New York. So that's very cool. Yep. Not insignificant. Yes. So thank you for sharing that. So I mentioned that I do want to talk about sort of your ability to sit down in the rooms and bring, people together. And so in a recent Washington Post opinion piece you wrote, you talked about pulling up a chair at the MAHA Institute Roundtable. So this is the Make America Healthy Again Institute, alongside NIH Director Jay Bhattacharya. Hopefully I said that name right. I tried to look it up beforehand. And people you said you're not ideologically aligned with, arguing that progress comes from engaging across disagreement rather than retreating. I'm a big believer in this, by the way, and I talk a lot about this in the book. So at a moment when trust in health institutions is clearly fractured, where does your optimism that we can actually rebuild that trust come from?
It's so interesting. I mean, I think if I lived in a world where I wasn't going out there and engaging the community and speaking to people in these communities, seeking out diverse opinions, just talking to everyday Americans, I would probably feel very unoptimistic, right? Because if you look at social media right now and mass media in general, we paint a pretty bleak picture. But the truth is, I don't know if you agree with this, Aaron. I mean, every time I go out there and have a conversation with diverse thinking folks, people who might disagree with me, people who I might not traditionally interact with as part of our siloed public health and academic conversations, which I do think are incredibly siloed and very much in an echo chamber, I always am able to find common ground. In fact, I would say that almost all those conversations, and I've talked to many people across the country, different states, different communities, diverse opinions, almost always the majority of what we talk about, there is common ground on. We might disagree on fringe issues, but it's the way that you have the conversation, right? In a non-vilifying, non-stigmatized, open-minded way, not talking down to someone that I really, really believe can make a difference. And that's what that MAHA article was about. I continue to engage heavily with the MAHA movement, trying to bring together traditional public health with MAHA leaders. Even on our own podcast, we're having some of those leaders on as well, because I think it's important. There are recent surveys showing that, for example, if you look at the MAHA conglomerate, very few of that group actually cares about vaccines. They care about other things. And those other things, I guarantee you, are many things that we probably all agree on. Food standards, right? Like the things that we can find common ground on, let's get more transparency when it comes to drug pricing. Okay, so how do we have productive conversations around areas of agreement rather than just focusing on the disagreement, which actually, in my opinion, is far slimmer and more in the minority than we think? That's the purpose of joining things like that and writing articles like that.
Well, so first of all, I am 100% aligned with you, and I have prided myself. I can remember probably a few having had too many beers in the pool with a couple of my buddies when I lived in Austin, and they were from the other side of the political spectrum, and just having very good, respectful conversations. And to your point, I think in a lot of cases, it's like 80% of the stuff we do tend to agree on. And it's the 20% that we disagree on. And while I'm not one of those media conspiracy theorists or, the social media is destroying our society, the more I think about it, it definitely has played a huge role. And I think especially in the last 2 or 3 years in dividing us. And it's really frustrating that that's the case. So I appreciate you calling that out. And I do appreciate you taking that leadership stance and talking in an opinion piece and sitting down with NIH and sitting down with the Maha Institute to do that. So,
and Aaron, let me tell you too,
please do.
that convening, you go to something like that, you would be amazed how much excitement there is also among people who work at the NIH. And these are folks, who lead, for example, the NCI, National Cancer Institute, who have been there through multiple administrations, who are saying this is the most exciting time they've been at the NIH. Now, the caveat would be, of course, we can talk about funding cuts, we can talk about the flip side, and that's all important to talk about. But in some of these areas, it's not the folks at the NIH deciding to cut the funds, right? And they might be doing things that are actually very innovative and changing the game a little bit. I'm an NIH reviewer. I've worked with the NIH incredibly. I've been funded by the NIH. I can tell you that the process of grant review, can be better. There are biases we need to think about. We always need to be thinking about how we can do things better. And I think there's a reluctance to do that because we think we're opening ourselves up to questioning things. But listen, I can tell you there was a lot of excitement in the room, not from Maha people, but from people who are currently working at the NIH as well.
Well, it's encouraging to hear. And I think, again, this is where the media comes into play. And all they ever want to tell us is all the bad things that are happening and all the disagreements that are happening. And I'll just go on a quick sidebar. So there's a woman named Mallory McMorrow, who I also had on this show. I just refeatured the interview we did. She's running for Senate in U.S. Senate out of Michigan. And you want to talk about a woman that is like right down the middle and running on the issues and talking to both sides of the aisle and saying, look, these are the people want jobs. They want healthcare. They want clean water. They want accessible food. And so, there are things like that it's like we do have a lot more in common than not. And I think a lot of people, both on the life sciences side of the fence, as well as the payer providers and the government, a lot of people that get involved in this stuff do it because they want to do good, right? They're not there to make zillions of dollars. Obviously, in life sciences, there are people that are bad actors. On the payer side, there are some bad actors. But I think in general, the people you find are smart, they care, they're passionate. So I love hearing you reaffirm that. So one of the things I do want to talk about that's sort of in a similar vein. So whether it's firearm injury prevention or early risk screening, a lot of the work you do emphasizes moving upstream to catch risk before it becomes a tragedy. And I think healthcare in general is trying to take more of this approach, and it's really the right approach, this health approach versus sickness approach. So for the next generation entering health tech or public policy, what's the mindset shift required to move from reactive problem solving to proactive systematic resilience building?
I think at the end of the day, you got to look at what the system incentivizes, right? And at the end of the day, how do you change the system? So how are we going to incentivize moving upstream? I think in the current system, we have to incentivize that either by getting legislation that actually, starts to reimburse for preventative care. Thinking about not just value-based care models, but how do we actually incentivize hospitals and providers to provide upstream preventative care when they are struggling to provide basic care? There's a balance there, right? And the current incentives for the system revolve around making money, especially in America. And so I think that's important. And we've seen those models work in different parts of the country. So we need to rethink how we incentivize that. In order to do that, I also think we have to better articulate what's the return on investment of these upstream interventions. I think there are some upstream interventions that don't make a difference, and I think there are others that do. And I think the more we start really being comfortable with asking ourselves which ones are working and which ones don't, the more we're going to be able to actually push these things forward. And I can tell you when it comes to gun violence prevention, preventing gun injuries saves hospitals a lot of money, right? A lot of gun injured patients are Medicaid patients. Hospitals don't get reimbursed at cost for those patients. They lose money. And not to mention the significant trauma and PTSD and downstream disability that's caused to those patients themselves and the subsequent economic loss and then future care that's required. So payers should care about this, hospitals should care about it, government should care about it. And so I think we have to keep hammering that economic argument. I think we don't do it enough. We think, hey, listen, this should just be a goodwill kind of issue. But, there's a lot of competing interests here, and they're not bad competing interests. There's just a lot to do. And so I think we have to change the system and rethink how we articulate that.
It's funny, and I appreciate that you're framing it that way, because I know there's a woman named Mary Stutz who I've worked with, and she runs the Businesswomen's Healthcare Association, Healthcare Businesswomen's Association, HBA. And she and I have talked for a lot of years over the importance of diversity in boards and leadership teams. And, obviously it's the right thing to do, but it does make economic sense. Same with Dr. Vanessa Carey, who's on a special envoy to WHO. We talked about this whole climate crisis and framing it in an economic perspective. And guess what? A lot of people understand economics or the power of, and so I think getting to that root cause and talking about that really is critically important. One of the next things I want to talk about is, as a convener of the National Specialty Care Access Coalition, this is a 20 plus health systems, plus partners like T-Mobile, Samsung, Savaro, which I love. You're building tech-enabled specialty care for rural and underserved communities. I think a lot of people, if you don't live in the middle of the country or some of the sort of extreme areas, you don't understand what a problem this is, right? So let's talk a little bit about some of the biggest hurdles to making sure that AI and digital health close access gaps rather than widen them, because I think that's another thing people don't realize is they think that technology and this magic wand of AI is going to just take care of all these problems. And in fact, it's actually doing the opposite in a lot of cases.
Yeah. Yeah. Great question. And just for listeners to understand, right? I mean, on a personal level, of course, there's a number of different public health issues that we work on, not only just on behalf of Northwell, but also just individually, as part of coalitions, in collaboration with other national public health leaders that I know well. And so gun violence prevention, maternal mortality reduction, improving access to care, examples of all issues that I've certainly been passionate about and worked with others on and learned from others on. And so that's where this coalition got started. I was hearing from a number of health system executives who I've worked with in the past when it comes to other coalitions and convened them for other issues, that there was a need for a more focused conversation on specialty care access in rural America, but also underserved urban communities. We often talk about primary care, and that's part of the picture as well, right? You need primary care, you need upskilling of those primary care folks, of advanced care practitioners as well. And I think that's where technology comes in as well, by the way, just for upskilling folks that are working in rural communities, because I think there's a lot that can be done before they see a specialist. But there's also a need for a conversation on specialty care. The days where specialists are going to move to every community in rural America, it's just not going to happen. It's never happened. And I think this is where technology can really serve as the unlock, whether it be AI, whether it be tech-enabled care, which means remote patient monitoring, yes, virtual care, being able to do things without actually seeing somebody, keeping care in the home, keeping care in that community rather than transferring patients. I mean, the number of patients we transfer who don't need to be transferred is crazy, right? Not to mention the number of patients who travel for hours just to see a specialist like me to be told they got the wrong tests or I'm the wrong specialist, or they now need tests and to come back 3 months later. Think about all the barriers there and how technology can solve that. So that was really the impetus for this, right? Access to care has been an issue I've cared about. How can we also bring together a coalition focused on this? So that coalition has grown now to 40 plus health systems, very focused on being a thought leadership group, focused on moving policy, working with CMS. Really important right now, of course, with the Rural Health Transformation Project as well from CMS, the 40 billion there. How's that going to roll out? How are health systems really going to lead? Right? They should be the ones leading, not vendors, not states necessarily, right? How do those health systems come up with infrastructure plays that really reach all parts of a state, all parts of America, to be able to provide ideal care? And so that's what that group is about. And they've had a couple meetings already. It's been incredible to see those health system leaders come together, think about where that group wants to go, work on their first white paper, for example, that's going to come out later this year. But it's a huge issue, and again, whether you're talking about rural America or underserved urban communities, seeing a specialist, for example, seeing a physician, it's incredibly hard for folks. Think about all those barriers I mentioned. And I don't think we've moved the needle forward tremendously on that. I think COVID, of course, accelerated telehealth, but telehealth is, by itself is not the solution, right? It's how can we think about all these other things together? And you mentioned AI. I mean, that's a big part of it. I think personally, there's so much that people can do without a physician, to be honest, or in this case, even upskilling a primary care doc to be able to do before you see a specialist. There's just so much AI can do that we need to start embracing, I think, if we want every American to get that care.
Yeah, I couldn't agree more with that. And I just did an episode recently with, you probably know a few of these folks, Seema Verma, who was the head of CMS, and she's now the head of Oracle Health, which may be a good partner if you haven't talked to her already. Amy Abernethy, who was recently at Verily and former deputy of the FDA, and Christopher Cooney, who's held a lot of sort of health tech positions, works with HIMSS, et cetera. So we talked a lot about AI interoperability and some of the things that we're covering today. This part I'm really excited about talking about because, again, I've known you for several years. It's funny because I know we've talked some about health, but a lot of times we talk about other things in life. So it's kind of cool to drill down. So one of the things that happened earlier this year is this movie came out, this documentary called All the Empty Rooms. So I'd love for you to tell us a little bit about that. But the movie took home the Oscar for Best Documentary Short. So congratulations. You are a consulting producer who helped shape what it asks of viewers after the credits roll. You said storytelling moves people in ways statistics can't. We started this up front, right, in talking about the importance of storytelling. So as an implementation scientist who lives in data, how has your relationship with data changed after seeing what a single film could do? So let's start with a quick explanation. I think people probably guess from the title, and then let's talk about that specific ask.
Yeah. And, I would say that for the last question there, I mean, I think obviously it's been a journey, right? Learning, and I'm still learning. But just seeing so many incredible storytellers across the country, by the way, so many other national public health leaders, physicians who have been mentors, how they can kind of move the needle through stories has been what's informed this. But this example, was really cool. It happened out of nowhere. I mean, I actually met the director, Josh, through the father of a child I treated. Who knew we were doing this gun violence prevention work and connected us. And Josh said, listen, he had this idea of this film. And it's been an honor to be with them in actually producing this film and being a part of that process. I've obviously never been involved in something like that, bringing that story to life. And I was very close with many of the families in this film. So the film, All the Empty Rooms, by the way, is about the empty rooms that are left behind from kids that, are unfortunately killed in mass shootings and what those parents go through. And they don't mention gun one time in the movie. But it's an incredible, in my opinion, viewpoint on what's left behind. And it can't help but resonate with so many people, right? I mean, we've screened this movie in Republican states, red states, communities you would think would never watch this. And everybody thinks about their kids, people they know, what they would do with those rooms, right? And by the way, many of these families who lost kids to mass shootings themselves are Republican, right? They never thought it was going to happen to them. And it's that raw imagery and so on that I think has moved a number of people. We're currently screening this across the country. We're doing congressional screenings. So we're ramping up that process now. But I have seen how it gets people to think about this issue differently, particularly not commenting on it as a political issue. Again, going back to our conversation about common ground, I mean, I have yet to find an American at all that doesn't want less mass shootings, no violence, and to keep their kids safe. I have yet to find one. And if you start there and you have a film like this, you can really portray the devastating impact. And then it's about nuance, right? You don't want to use a film like this and vilify gun owners, or so on. That's not what it's about, right? This is about targeted things that we can do to stop mass shootings in this country, for example, which really have to do with AR-15s and assault weapons. Let's have a conversation there. Let's not target gun owners in the country, who, by the way, are our biggest supporters, biggest collaborators, many of whom are for responsible gun ownership. How do we take this film and now leverage it to the next level? So it's been incredible to see the impact it's had. Once it was acquired by Netflix, again, thank you to Netflix for getting that film out there. That really helped. And the Academy Awards, millions more watched it as a result.
Right.
And and the amount it's meant to the families who were involved in this film, that's really what it's about. For them to share their story, for them to then be able to get support for their initiatives, that's been absolutely monumental.
Well, again, kudos. It's such an honor, and you felt like exactly the right person to be involved with something like that. And I do like that non-political way of portraying it. This is sort of a good follow-on, I think, to that. So this is about the sort of screening reframe. So the positioning is like we ask everyone. So screening for firearm risk the way we screen for smoking, it's a quietly radical reframe. So where did the conviction come from that you could change something as entrenched as how the whole system thinks about guns, and what kept you going when it was slow? Because I know you just touched on some of that and the fact that there are a lot of gun owners that that do want more responsibility. You know, I have a friend, I actually, just a slight digression, after one of the millions of mass shootings, I went on Facebook, and I never do this. I'm never political. And I'm like, look, I know none of us ever want this to happen again. Let's sit down and have a conversation. And I was a little surprised. My friends on the left were actually less willing to have conversations versus just hurling their sort of like statements versus the friends on the right. And I learned a lot of things. And what was interesting is I had a friend that I grew up with in high school who actually owns some semi-automatic weapons, but he keeps them at the range. He's like, I think they should have the same training that you would have to if you get a driver's license. You know, you can't use the thing outside of a range. It stays there forever. So if you're going to use it, now I don't know if I agree with that or not, but there are things like that where it's like, if you want to shoot it, do it in a responsible fashion and don't ever let it get outside of the range. So people do bring it into schools, especially people, because I know the mental health thing is a whole nother layer that is complicated, right? Because there are a lot of vets that come back that have PTSD, and, you know, if they do the mental health piece of it, then they can't necessarily own the weapons. And so it's a much more convoluted and complicated situation that I know you know this in spades than I ever really realized. But anyway, back to the question. Sorry to digress. I'd love to get your take on that.
Yeah, no, I mean, that's such a good point, Aaron. I think it has to do with being open-minded again, right? Going back to what we said, I mean, if you want to have these conversations about these topics, how can you be open-minded? I agree with you. I mean, sometimes, again, and I would say in our academic community at large, the conversation is not only siloed, it's also just hard to express opinions, you know, and we need to reflect on that. So you're right. When it comes to gun violence too, it's like people talk about this as a broad issue. They don't talk about the fact that there's mass shootings, there's interpersonal homicides in urban communities, for example, there's suicides, there's unintentional injuries. They're all very different. And so you need to have a lot of nuance there. For example, I would argue that gun owners have very little to do with the majority of gun violence in this country, right? That has more to do with lack of economic opportunity, you know, social isolation, the big drivers of violence, for example, community violence, illegal guns, right? So like, how can we have this conversation in a proactive way where we talk about that nuance rather than just blaming others? That's where it starts.
Yeah, no, that's brilliant. So this next question is about, you know, you being on the other side of the mic. Today, I get to interview you, but you host a 20-minute health talk, and you've interviewed some pretty awesome people, including Mark Cuban, Chelsea Clinton, Bill Frist. So what's something you've learned as an interviewer about how the best leaders actually communicate, and has it changed how you show up?
You know, I love the thing I love the most about conversations like this and doing a podcast is that you just get to speak to somebody. You know, you have a more long form conversation, you get to learn about them. I mean, for me, it's been wonderful. You know, a lot of those folks, you know, been fortunate. Chelsea Clinton's been a good friend for a while, so get to chat with her quite a bit. But, you know, Mark Cuban, Senator Frist, we've connected, but never at that deep level. And you really get to know somebody, and you get to know about, as you asked me, their origin story, what drives them, how they maintain their leadership skills, how they balance their lives. So I would say, actually, honestly, the biggest thing that I take away is I learn a lot from those conversations about what I want to apply to my own life, to be honest. I get inspired by a lot of those folks. It's just incredible to me how many people in this country want to change the world for the better. And again, that goes on both sides of the political aisle. Like, you know, a lot of these folks want things to be better. They might just have different ideas about how to get there. That's probably the biggest stuff I've learned. And that, you know, those conversations are also hard. I would say that the more controversial conversations, they can be tough to have on a podcast as well. But that's something you learn with time. Still learning.
Yeah, no, for sure. And so kudos to you again for that. Like, this is just, like I said, all these fun things. I sort of had started to find some of these things out about you because I've been spending more time on LinkedIn, and I'm seeing your content and trying to comment on your content. So it is cool to say, oh, I've known this guy for a while, and I always knew he was smart. I always knew he was doing cool things, and now I really know the cool things he's doing. So couple more serious questions, and then we'll get into the lighter heart and we'll wrap this up. But after everything you've seen in trauma bays and empty bedrooms, what gives you genuine hope right now? And what's the next empty room you're determined to keep from happening?
Yeah, you know, I'm very optimistic, actually. You know, I think, again, let's go to the stats, right? Last 2.5, 3 years, Firearm homicide rates in this country in almost every city above a population of 100,000 have drastically dropped. We have some of the lowest murder levels in America right now that we've had since 1960. There are reasons to be optimistic, right? A lot of programs that we've invested in, whether it be community violence intervention programs, better collaborations with law enforcement, other public health strategies, healthcare strategies, they've worked, right? Our gun rates are down. I can say the same for substance use. I can say the same for motor vehicle collisions and so on. And so public health is working. It's working in different areas. And I would say that on the gun violence side, by the way, those stats are despite the fact that Americans are still buying a lot of guns and that gun laws have become more lax. So again, we can't feel so hopeless. We have to look at the nuance and look at why it's working. So that gives me optimism. And I'll tell you that every time I meet a family who's been affected by gun violence, what also gives me the optimism is how incredible those families are and how much they are doing to change our worlds for the better. Again, going back to this film, those families that were involved in mass shootings, they are incredible. And when you do this work and you realize that little things you can do to support them can make a difference, but then you meet them and they inspire you, that's what gives me the most optimism, right? That they're able to also find common ground. They're able to meet people and find that common ground. So it's really those conversations that continue to drive me.
Well, Chethan, I love that you're feeling that way, because I'm feeling like I'm a more optimistic than not kind of person. And there are days where it's easy to get discouraged. So hearing you say that, and I think reminding ourselves of the stats, that sometimes you forget those things. And so again, the media sometimes gets in the way and wants to only tell us the negative that are happening. So I appreciate that.
Well, last question. I always say to people too, you know, like look at your life and what's happening around you rather than the hysteria, you know. And I think a lot of us are privileged. That's the way I look at it. We're very privileged to have great lives and the things around us. And a lot of other people aren't, and have been through tremendous loss, you know, and it's like remembering that is important as well.
Yeah, no, that's a fantastic point. So the last one along these lines is just, you're out there. I see you on LinkedIn regularly, but where can people find you and engage you with the work you're doing and even get involved or support if they want to go that far?
Yeah, please. I would love that. I mean, reach out, always looking for cross-sector collaborations, innovative ways to tackle any of these public health issues. Message me on LinkedIn or Instagram at Dr. Chethan Sathya, and I'd love to chat.
Perfect. All right. So these are the more lighthearted. There's three lighthearted and one slightly more serious question, but more personal. What's a show or podcast you're binging right now? Ideally something light or funny.
It's a good one. I was thinking about shows. I'm like, obviously I started watching, you know, House of Dragon because the new season's out, but that's not light or funny.
That's a fine answer though, by the way.
I do listen to, and the podcasts I listen to are not funny either. They're serious. Like I listen to the All In podcast, right? You know, which tends to lean a little bit more right. I listen to podcasts across the political spectrum because that's the only way I learn about what people are talking about in different areas and where I can open my mind. So that tends to be what I look at. The funny stuff I'm watching right now has to do with the kids, you know, like Bluey and things like that, and probably kid shows.
That's good. I just listened to one, probably not funny as well. It's called Love Trapped, and it was kind of an amazing story as a podcast. And we sort of, I guess we're watching a lot more serious shows than not, but there was a dark comedy. It was called Widow's Bay, and it's sort of horror. It's sort of comedy. It's very eclectic. Yeah, it's on, I believe it's on Apple TV. Anyway, it's worth watching if people are looking for a show. Yeah.
I got to watch that.
I know you've met a lot of important people in your life. Who has impressed you the most?
Well, you've impressed me.
You're kind.
For sure. After I met you and your ability to talk to so many different people and just incredible work you've done across so many different sectors. People who have impressed me, I mean, there's so many. I mean, you can't help but be humbled in this country in particular when you get to meet so many incredible folks who are trying to change the world. There's such a long list. I would say one of the people that's impressed me most and not only continues to inspire me, but just really does impress me is actually Chelsea Clinton. You know, she has incredible humility, always makes time, never makes you feel like the questions you ask are silly or beneath her. And she's got a lot of lessons there. And so I really enjoy my conversations with her.
That's a great one. I think, do you know Dr. Bio? She was on stage with her at Health, I think 2 years ago, and she had similar remarks about her. So it's good to know. And I'm not shocked, but you just never know sort of until you meet someone what they're like or how they show up. All right, second to last question, biggest regret.
It's a hard one. Number, right? There's a number of regrets. Sometimes you think about your family and spending more time with them, your parents. On the professional side, biggest regret probably is that I didn't dive into this work sooner. I think, again, as a surgeon, you spend your whole career. I spent 13 years training to be a pediatric surgeon, which I'm super fortunate to do. Love my career. It's still the best part of my week is operating on kids and being able to work with those families. But I think, I wish I embarked on some of these things earlier. There's a world of opportunity out there. I would encourage everybody, no matter what career you're focused on, don't silo yourself. Start working on these things earlier.
That's a good one. And it's, again, something I wrote about in the book, this idea of legacy and sort of building that legacy early. And it's never too soon to start. And so you've done quite a bit. So it's funny that that's your regret, because some people will look at you and say, holy crap, this guy's done so much. But I feel you. I feel the same, that there's probably more that I could and should have done at an earlier age. Last question, a little more fun, a little lighter. A band or artist that ideally you can't see anymore because they're no longer around, that you would most likely to have gone to see in concert.
For me, it's probably Michael Jackson. Never saw him in concert.
That's a really good one. Did you see the movie?
I did.
Did you like it?
Love the music. Yeah, I did.
Okay.
Love the music. I would just like to see him in person one day.
Yeah. I didn't realize it. I guess the guy that plays him, I think, is like his nephew or cousin or something like that.
Really?
So
yeah. I didn't know that.
Yeah, because there are some people that have seen it. I've not seen it yet. I know some others that have seen it and loved it. And they're like, oh my gosh, he looks so much like him. And it's like, well, there's a reason why, because he's actually related. And so that helps with it. So that's good to know. Well, Chethan, thank you so much for taking the time. It's been a pleasure. I really loved getting to know you a little bit better. Because again, we have these people in our orbit. They're important. They do cool things. I knew about the gun violence prevention, but learning about some of the other pieces, the CNN piece, I didn't know about that. And, I want to say thank you. I'm so blessed to do this show with these people that are dedicating their lives to making the world better. And clearly you've had a huge impact and will continue to have a huge impact. So I appreciate that.
Thank you so much, Aaron. And likewise to you. It's been an incredible honor to meet you, and, a lot more work to be done.
So much more.
So.